Each organ in our body carries out a very important task, like keeping our blood pumping, delivering oxygen, and breaking down nutrients. Imagine being told that just one of these organs was no longer working as they should, and to keep living or to enhance your current state, you need another one. For the 103,000 people registered on the national waiting list, this is a reality. The National Transplant Waiting List is a database that lists all the people who are eagerly expecting an opportunity to receive a life-saving organ. But registering isn't like waiting in line for your ticket number to be called, and the U.S. organ donation system describes it as a giant pool of patients, and for each of these patients, finding a match isn't always easy. The waiting list can offer hope to the men, women, and children who have registered, but the truth is, every 9 minutes, another person is added to this list. The hope they so desperately need is a gracious gift of an organ or tissue donation. Declaring to become an organ donor is a personal and important decision. People who've decided to become an organ donor have the potential to save many lives. According to the Texas Organ Sharing Alliance, or TOSA, in Texas there are more than 10,000 people waiting to receive an organ donation, and many will die waiting for an organ to become available for them. It's important to decipher fact from fiction because the myths and misconceptions that surround organ donation are plentiful. This can make it difficult for anyone to make the best choice and hinder recipients who need a second chance at life. Now today we're talking about organ, eye, and tissue donation. We're going to be talking about some of the myths and consulting you guys, our expert panelists, about the facts. And throughout the show we're going to be talking to different panelists from Donate Life Texas, South Texas Blood and Tissue, the San Antonio Eye Bank, and University Health. And we're also going to hear from community members who have personally been impacted by organ donation. So thank you all for joining us. I'm so glad that you guys are here to talk about this important topic. Yeah. So first we're going to be speaking with you, Kimberly Monroe from South Texas Blood and Tissue, and then Jim Wagner from the San Antonio Eye Bank, and Jennifer Milton from University Health Transplant Institute. Okay, so let's start talking about some of the popular myths and misconceptions that some of the donors have. Jennifer, I want to start with you actually. So having worked in the transplant field for 30 years, I'm sure you've heard a lot of the misconceptions about it.
Absolutely. I will say that what we've really been pushing for is to make sure people had the opportunity, and because sometimes we drive right into the myths and really they just haven't even had an opportunity to register.
What are some of the myths that you've heard from people?
Some of the myths are that it costs a lot of money to get a transplant, that they don't think that's fair, and maybe that they don't want to donate into a system like that where there's a perceived unfairness of the system, that in fact that people won't attempt to save their lives if there's an emergent situation simply because they had previously expressed their wishes to be an organ donor, that it takes a lot of time, or that even their religion might prohibit it. And I say all those things stressing those are all myths.
Mm-hmm. Yeah. So one of the other things that we've heard people have concerns about whether or not they're eligible to become an organ donor is their age, any health issues like diabetes, cancer, HIV. Is that an issue?
It's not. We tell people to register to be a donor. You never know at the time someone passes what may be going on with them, but you can be a donor and have HIV. You can be an organ donor and be a very advanced age, upwards in your 90s plus. You can be an organ donor and have had diabetes, heart conditions, all pre-existing conditions are acceptable. It's at that moment we have to evaluate if there's any other infectious issue that might be going on, but none of those general medical conditions are contraindications.
And I know some people might have some concerns about whether or not you mentioned religious beliefs, but also if it'll impact the fact that they want an open casket funeral. Does that play into that at all?
It's the families and the next of kin are always very educated, and they're explained that it's not going to change their appearance for an open casket funeral if those are what their wishes are, and they work with them closely on any delays that they may have. And then also a lot of times one-on-one with those families, you really begin to educate them on actually what their religion does support, because although they may be very practicing members of that religion, they haven't gone through to that little detail to find out if they support organ, eye, or tissue donation. And in fact, all major religions internationally and in the United States support organ, eye, and tissue donation.
And I know we have a graphic up here talking about some of the misconceptions that doctors won't save your life in an emergency, which isn't true, right?
Absolutely not true. The registration system where you've registered to be an organ, eye, and tissue donation, it's a secured system that only if you are an employee of one of the authorized organ, eye, and tissue donation agencies can you go in and verify their status. So physicians that work in emergency rooms, nurses, staff, they can't even access the system to determine if you were a registered donor. And every effort will be made to save your life. It's only after it's been determined you've died or it's futile that organ donation, organ, eye, tissue donation is even a consideration.
How can people become better informed about whether or not they are eligible to become an organ donor?
Well, apparently they can watch KSAT and they can listen to this town hall, and they certainly can just look online. There's incredible resources on any of these great organizations that are here with us today, TOSA, South Texas Blood and Tissue, or San Antonio Eye Bank, even at University Health Transplant Institute. We've got those basic facts. But I think for me, I would mainly tell somebody, you absolutely can be an organ, eye, and tissue donor. The most critical thing you need to do is register your wishes. And because no one expects that your death may be very far off, 20 years from now, 25, we never know. At that time, that's when they'll have to make that determination.
All right, thank you, Jennifer. We'll ask you a couple questions in a second, but I want to turn to you, Kimberly. Sure. You're from the South Texas Blood and Tissue Center. So from bones to ligaments, tissue donation can help the lives of so many people.
Yes. Yes, absolutely. So one donor has the opportunity to help 75 or more people through that gift. And to point out one of the things that Jennifer talked about, just education is so important. One thing that we also stress to people that if you do join the registry, it's great to have a conversation with your family about that. So that way it takes the burden of that decision off of them at the time that you do pass away. So your family knows exactly what it is that you would have wanted. In addition to the tissues that you mentioned, we can also recover heart valves, we can recover veins. These are life-saving surgeries that help to restore blood flow, prevent amputation. They are used to save many lives, especially children when it comes to heart valves. We also recover skin, which people often know about with folks who've been victims of burns and other types of trauma, to help as a protective barrier to prevent infection and other complications. And then we also can recover nerves that can help to restore sensation and mobility. There are just so many different uses for tissue, so it's just an extraordinary opportunity to be able to help a patient in need.
Yeah, and so you talked about the importance of making sure that your family knows what you want. How do you go about having that conversation?
So I'm a strange bird. So I think that any opportunity that you can gather with your family and really sit down and be intentional about it. Last year, for example, I was together with my family for Thanksgiving for the first time in a long time, and we sat down at the table and we had a conversation about what we would want at the end of our life. And I think that's one way to do it, to just be intentional about that conversation and to make the time to tell whoever your loved ones are, I've made the decision to help save lives through organ, eye, and tissue donation. I joined my state registry, and I wanted you to be aware of the decision that I made.
What's the difference between tissue donation versus organ donation?
That's a great question. So people often think of organ donation as an opportunity for one person to save 8 lives. So you usually have one organ recovered from that donor. That one organ is transplanted into a recipient. With tissue donation, you also have a one-to-many type of donation, but really it's one individual tissue that's recovered, can be fashioned into grafts that can be used for a multitude of reasons. So for example, if we recover bone, that bone might be fashioned into something like a spinal fusion graft, or it can be made into powder or paste or putty to help people who have damage to their bones through trauma or cancer. So think of like one tissue that's recovered can actually have multiple uses for that tissue itself, which in turn helps multiple individuals.
So I'm sure, like Jennifer, you've heard some of the myths behind organ donation. Sure. What are some of the myths that you've heard behind tissue donation?
They're pretty much the same. People often think that their life won't be saved. They may think that there's a cost for donation, which there is not. Any cost that is related directly to the donation of tissue is not passed on to the family. Also, funeral services are common as well. So nothing really beyond what she mentioned. Cost. It would preclude them to have a viewing during their funeral services. So we have those myths in common.
And so what are some of the different types of tissue that can be donated?
So as was mentioned before, heart valves and veins, arteries, skin, bones, nerves, tendons, ligaments, and adipose tissue. And I think beyond transplant, there's also lots of opportunity there for tissue to be used for the advancement of medical research and education. And similarly to organ donation, there actually are also living donation opportunities. So we actually collect cord blood and birth tissue at South Texas Blood and Tissue as well. Cord blood can be used to help treat patients who have leukemia, other blood cancers or blood disorders. And birth tissue like placenta can be used to treat wounds and to help reconstruction after mastectomy or other types of procedures.
How often are tissue transplants done every year?
Great question. We have approximately 60,000 or so tissue donors annually, and 2.5 million grafts are transplanted every year. So it's an amazing opportunity. Again.
And that's a mix of living and...
For the most part, with deceased donor, about 2.5 million grafts, but I would say yes for both tissue types because of the uses of those types of tissue.
Okay. Well, thank you so much. And Jim, I want to get to you. You're with the San Antonio Eye Bank, which gives a sight to people who are battling diseases or other issues that can cause blindness. You know, people might not think of donating eyes when it comes to organ donation, right?
Yeah, well, it's very common that people do not realize you can transplant the cornea, or they're unsure, they think that we're trying to transplant the entire eye, which we're not. We don't have the capability to transplant the entire eye, but we do have the ability to give people back sight that are suffering from corneal disease by transplanting their cornea.
What are some of the myths you hear around that?
Disfigurement's a primary one, especially with cornea, because it's it's visible, and they're always worried about open caskets. So it's important that we talk to families about the fact that we are just recovering the cornea. The rest of the eye stays in place, so you can typically have open casket viewing after becoming a cornea donor.
Are there any eye issues that would stop someone from becoming a cornea donor? Like, I wear contacts. Like, I don't have 20/20 vision. Would I be eligible?
You would. Even cataract surgery, past eye surgery does not preclude someone from donating their corneas to be transplanted.
How successful is cornea transplantation?
97%, so very successful. But a lot of people, we talk about myths and different ideas that people have, and typically with the eye, people think that they're too sick to donate organs or tissue, and with the cornea, they think that their eyes are, they have, like you said, they wear contact lens, or they talk about they really have very poor vision, so they assume that they cannot donate their corneas, but they can. It really has no impact on the effectiveness of a cornea transplant helping somebody.
What's the big difference between a cornea transplant and any other organ donation? Do they have to take, any drugs like immunosuppressants?
Yeah, there's no tissue typing or anything like that. We try to match them up according to the approximate age of the recipient. So that's about the only matching up that goes that's involved in it.
Are there any healthy eye care practices that can help someone prevent the need for a transplant?
Certainly diet can actually have an impact on its effect on your cornea, and staying out of the sun, wearing eyeglasses, proper eye protection, all of those things, and preventing eye care injuries during, we do a lot of education during 4th of July and times when people typically have potential eye injuries.
Can most blindness be cured by cornea donations or transplants?
It can cure corneal blindness, but there are different reasons that people go blind, and it cannot cure things like diabetic retinal problems or glaucoma, those types of things that can cause you to go blind, but it can cure the diseases of the cornea that cause people to go blind.
And so, unfortunately, but these, the donated cornea has to come from a deceased donor, right?
Yeah.
So how do you support those grieving families who make that choice to give that gift?
Yeah, I think one, when the family will receive information from us, they really want to find out what happened with the cornea, and often families want to communicate with the recipient, and vice versa. Recipients sometimes want to communicate with the donor family and vice versa. So we try to provide them information about what happened with the cornea and support them in that way. We do various things throughout the year to try to honor donors and their loved ones. We also have brief support things that we put on to help them during times of the year when they're going to be suffering, from loss of a loved one and grief. Like during the holidays, we'll put on, support things for families. And also it's an opportunity for them to meet with other donor families and kind of just share that amongst them.
And I want to open it up to everyone, and feel free to jump in, but you left off on a perfect point, because I want to talk about that moment when it's time for a family to decide whether or not their family member is going to become a donor. So how do hospitals and procurement organizations work together to give a life-saving gift to a patient?
I think one of the most important things to highlight is that it is a collaborative effort, and most folks don't know that when someone does pass away at a hospital, that hospital is required to report that death to their local organ procurement organization that they are assigned, so they don't have a choice in the OPO that they work with. So behind the scenes, you have that one phone call being triaged to 3 different organizations in some cases. So in some states or in some regions, your organ, eye, and tissue organizations may be separate entities. In some places, they may be under one umbrella. But here in San Antonio, we have 3 organizations that work cooperatively to serve this area. And so those conversations are happening with one organization to that family. So the great thing is the way that the system is set up, the family doesn't have to have multiple conversations with multiple organizations for a donation to take place. So I think that's an important thing to highlight.
Did you want to add anything, Jim?
No.
I would just kind of come back to a previous comment you were all talking about. And one way I really like to tell the general public to think about registering their wishes to be a donor is that we like to say nationally, that's you saying you want to give 83 futures. And so you heard sort of the numbers of the average number of organs that can be transplanted to people's site restored, up to 75, and in some cases even more individuals whose life are better, enhanced, or after a tissue transplantation. And I think that's really powerful because registering to donate is less than 90 seconds. And although Kimberly appropriately said share your wishes with your family, there's no legal requirement that your family weigh in if you've actually registered. So this is the 13th year in the U.S. that organ donation and transplantation has broken the previous year's records. And 62% of Americans with a driver's license have legally said yes to donation, which is amazing. We've been in these careers a long time, but that means 6 out of 10 times when you walk into a situation where they've called to make that call that someone's unexpectedly or has passed away, 6 out of 10 times, that person has already said yes in a way that's legally binding. And it's an amazing comfort to call a family and say, or talk to a family in the worst moment of their lives and say, your son had registered his wishes to be a donor. Let us walk you through what happens next. Instead of anguishing over that decision of what would they wanted or feeling that pressure that you have to make that decision, you watch these families sort of transform into this sense of great pride. Wow. He really wanted to be a donor. So I know when TOSA comes up later for the part of the segment, they'll really share that registration. But I always say, less than 90 seconds, and you can change 83 futures. What a legacy.
Yeah. Go ahead. I love that so much, and I think one of the other things I love about encouraging people to have the donation conversation with their family is it encourages and inspires people maybe who hadn't considered donation before. And so I know, I'm sure my dad won't mind me saying this in public, but my dad's a retired firefighter paramedic, and even in the course of saving lives, I don't think it ever occurred to him, and until I started working in this field and expressing my passion for it and signing up as a donor myself, I was pleased when he let me know, hey, guess what I did when I renewed my driver's license. So I think in having that conversation, you're encouraging others to do the same. So we're taking that we're demystifying it, we're taking the stigma away from it, we're helping people let their guards down, release their fears, and just be open and honest about why you would decide to give such a great gift. And I'll say one other thing. The thing I love a lot about the industry that we work in is not only does it give us the opportunity to help people save other people's lives, but when you register as a donor, you don't know who is going to receive that gift after you pass away. And you're not thinking about their age or their race or their gender, their sexual orientation, their religion. So you think about the idea that you get the opportunity. People are willing to do that, not ever knowing anything about the person whose life they might save. And for me personally, there's just something so remarkable about that. It's an opportunity to just bridge people through just a really beautiful gift.
And it's something as simple as going to the DMV.
As simple as saying yes when asked, do you want to be an organ donor? So, and I think it's an amazing opportunity.
And so I want to talk about one of the people who has benefited from organ donation. We're going to introduce you to him. It's a San Antonio family. They're sharing their story to encourage others to give the gift of life. We spoke with Zach Baza earlier this week. He's 16 years old, and I want you to watch this story and just see how it's changed his life. Zach Baza is a pretty laid-back 16-year-old.
I like to hang out with friends and read books.
Oh my gosh.
His mom, Carmelita, can't believe he's made it this far.
I'm so proud of him. I mean, I'm proud of where we are.
Soon after Zach was born, doctors realized his liver was failing. At 6 months old, he needed a triple organ transplant, a new liver, small bowel, and pancreas. Doctors weren't sure if he'd live long enough to get them and prepared Carmelita for the worst.
I didn't even know what to do. I was like, how do you make funeral arrangements for a baby? I mean, I couldn't wrap my head around it.
In April of 2008, the family of a 4-year-old who lost their life realized their child could live on in another.
It would take me a while to find the words other than thank you, and that's just so incomplete, so inadequate, you know.
A scar on Zach's stomach serves as a reminder of what he's overcome.
I used to say that I think I got cut with like a samurai sword by an actual samurai.
He doesn't remember what the start of his life was like, but Zach knows how he plans to live the rest of it.
It's a blessing, basically. And it sounds unreal, but it's just that I'm grateful to have what I have.
Daniela Ibarra, KSAT 12 News. And Zach was so young when he got his organ donation, he doesn't really understand the full impact of it other than he knows it saved his life, but his mother uses him to spread the story of the importance of organ donation. And one of the organs he got is a liver, and two of the most needed organ transplants are the kidney and liver. We hear a lot about people donating a kidney or liver when they're alive opposed to patients waiting for an organ from a deceased donor. So I want to open it up to you guys. What are some of the advantages of having a living organ donor? And welcome, by the way.
Thank you. Thank you. So good to be here. Thank you for having this conversation. The benefits of living donation are many. I would say one of the most important benefits is a patient does not have to wait. For a deceased organ, the organs will be allocated based on different metrics, but there is a waiting time. In kidneys, it takes years. In our area, 6 to 8 years on dialysis before you would come up for a kidney potentially. In liver, you have to be quite sick. And sometimes you become too sick and you can't not then have the transplant. So with a living donor, it takes away that wait. You no longer, I compare it sometimes, you don't have to wait in line. You are pulled out of that line and you get your life-saving transplant. Another benefit is quality. Only the healthiest people get to be a donor. So then in turn, the organ you receive from a living donor is incredibly healthy and you get a potentially a better organ.
And so with Zach's story, he was 6 months old when he got it was a triple organ transplant. It was small bowel, pancreas, and his liver. His family's so thankful that, the family of another was able to give. But I mean, it was tough for that family. They lost their 4-year-old.
Of course.
And it can be emotionally difficult. So can you talk about the importance of donors like this one to families who are so desperately in need of a kidney or any organ?
Yes, what it's like to be in the need. It is, yes. It is a very, very challenging way to live if they live at all. In the world of kidney disease, and honestly, once you go on dialysis, it's worse than many cancers. The survivability of a patient on dialysis is worse than many cancers. It is a reality that people die on dialysis. They don't really live. Their quality of life is very diminished because of the schedule they have to keep, and the consequences of dialysis. Ultimately, they'll die much sooner. So, although a donor family is under a tremendous, sadness and maybe the difficulty of loss, they are creating a legacy with their loved one in that they can live on through another person. And recipients of these organs, they go on to celebrate birthdays, graduations, weddings. I mean, they get to live their full potential. And many patients who could not be working, could not be contributing to family or their community, they live up to their full potential once they get that organ, and they get to live the life that they hope to live.
And earlier you had talked about living donors.
Yes.
Can you touch on the importance of living donors for pediatric patients?
Yes, of course. So Pediatric patients, so near and dear to us in that it's just such a tragedy when any young person is suffering from end organ disease. As I mentioned before, a living donor really are the healthiest of organs, and we want, therefore, the pediatric recipients hopefully will get an organ that will last them for years to come. So the best possible transplant they could get is a living donor transplant. It increases the opportunity for them to keep that same organ for years to come. People can get retransplanted. You can have more than one transplant, but technically, surgically, even sometimes in terms of matching, it becomes more challenging. So not all patients who need another organ would get one. So the idea is that we want that organ they receive to last as long as possible and be the best possible organ. And that's what living donor does.
Jennifer, I want to go to you because, when it comes to family, you want to do everything you can to try to save your family member's life, right? And I know a lot of families, they'll try to test to see if they're a match, but sometimes they aren't. What happens then?
Well, what I would say is remarkable, particularly at University Health Transplant Institute, but it's happening around the country and it's really gaining momentum, is we really stress to people who need it. We stress to everyone who comes to us for liver and kidney, find a living donor. We've cultivated a program run by a marketing expert for Donor Champion to actually train families to raise awareness and make that ask, because you can only get a living donor organ if you share your story, right? But what we really encourage them to do is when they're spreading the message that they need a living organ donor, liver or kidney, never talk about matching and never talk about blood type. You do no longer need to match your blood type or your HLA or your specific matching, because almost half of the living donor transplants happening, or nearing half, are from what's called a paired exchange. So I love to tell a living donor, your superpower is you can save 4 people with 1 surgery. And that's because if you don't match your sister, then you can pair to someone else, they can give to them. So we do these amazing, and many other programs do these amazing multi-chains where everyone gets saved because one person came forward and then you were able to match them in a chain. So just like deceased organ donation, you need to share the story. People need the awareness, and when they come forward to be living donors, they know that they're going to be able to save their loved one either directly through a matched transplant or through a paired exchange. And recently, Dr. Thomas really began to speak to our families about, look, you do match your husband, but you could also do a paired exchange. And I loved one of the living donors said, how could I not save 3 people? Just like my husband. Right. And she came forward and she, even though she was compatible with her husband, she wanted to put her kidney into one of those chains and save 3 people's lives doing so.
That's incredible.
Yeah, amazing.
And so I know University Health, the Transplant Institute, has a program called Donor Champion to help patients identify living donors. How does that work?
So I'll tell you, University Health is unique. We're one of a handful of transplant programs in the U.S. who even offers living liver donation, right? So if you get referred to our transplant center, I like to say you have twice the chance of survival, just because almost 50% of the liver transplants we do are from live donation, and there aren't other active programs in this region of the country. So our Donor Champion program is unique in that it supports and advocates for both people who need liver transplants and kidney transplants. And as soon as that person comes to us that needs a transplant, we immediately begin to educate them, just as Dr. Thomas said. The average wait for a kidney can be 6 to 8 years. The life expectancy on dialysis is 5. Livers are given to people only at the very sickest, and that's when most people die. So that's why they need a living donor, and they've got to share their story. So our Donor Champion program was really centered on the premise of connecting people who were experts and educating them, experts in social media and storytelling and traditional media outreach, things like you're doing today. Because you can imagine, and probably in your own life, in any condition you can think of, when someone asks, hey, can I do something for you? The natural human instinct is, no, I'm fine. Right? People are reticent to talk about their own health. People are really reticent to allow people to help them. I think it's just hardwired in the American culture. So the Donor Champion really overcomes that barrier and often trains a other family member or friend to tell that person's story with their permission. So it's really great. We had a beautiful story with a young infant transferred to us from Dallas, dying on the waiting list. They didn't have an identified living donor, but they were willing to go to media. In about 3 days, 1,008 San Antonians contacted us because that family was trained to have a champion and raise awareness. 1,000 people called. San Antonians, you ran the story, thank you. So, and that's what our donor champion does, helps our recipients and our candidates dying on the waiting list share their stories.
So let me ask you this, let's say I get tested to see if I'm eligible. How soon after I do that test could I get matched with someone?
As a living donor?
Yes.
Yes. So, very quickly, honestly. So we leave, as I always tell my donors, no stone unturned. As much as we believe and know the benefits of living donation, our priority is the donor. Okay, so when someone comes forward, we're so grateful, but then I would say the necessary screening and testing begins. We just have to make sure that you are healthy enough to be a donor. That's part one. Part two is, do we believe, based on your habits, genetics, etc., that you will continue to live a wonderfully healthy life with your one kidney or with your piece of liver? And so that's where our work begins. So the testing is, we have to make sure appropriate cancer screening has been done. Anatomically, we have to do some imaging and some basic labs. If anything comes up that we didn't expect, we may explore that. So we've had donors go to the OR as soon as 2 weeks. We've had some that may take a little more time than that. It's all with the priority of the donor's safety and health in mind.
So you talked about some of the qualifications that donors need, and I know one of the things people ask about is, well, does my ethnicity play a role in that? Does it?
No. Gender does not play a role. Religion, ethnicity, it does not matter. It only matters that the donor is healthy. That's what we say all the time. That the donor is healthy, and then ultimately a match. But again, to reiterate what Jennifer's saying, you do not necessarily have to be a match to your intended recipient to give the gift of a living donation. We consider all of our recipients and donors now to be part of that paired exchange. What I tell my recipients is, we want the best organ for you, and the best organ may not be from your sister or from your daughter. It may in fact be from someone you don't yet know. But in looking at the mix and match options, we have the best pairing. So we take that trust very seriously. But it's just such a joy to be part of that big chain that can happen.
Yeah, and you talked about, let's say you're my sister and I wanted to donate to you, but we might not be a match, but I could still donate.
Absolutely.
What are some of the qualifiers that would be considered eligible?
So we consider, first of all, age, anywhere from, I say, 18 to 70. As long as you're healthy. We have gone a little bit older than that, maybe for an older recipient, but age is the first priority. And then in good health is the second. And then, and then some other qualifications, for example, for kidney, someone who's diabetic could not be a kidney donor with, again, concern for their future health. And some maybe other minor diseases. We have to make sure the cancer screening is up to date, but really any age and in good health and committed to a healthy lifestyle is what we would say.
And is there a difference between registering to become, when you're at the DMV and you decide to, say that I'm an organ donor, between that and then becoming a living donor?
Well,
Yes.
I'll tell you, Texas is unique. So absolutely, the pathway to become a deceased organ donor and register your wishes that you want to become an organ, eye, and tissue donor happens, years in advance, usually at the DMV. You can do it on your iPhone now, or just on a quick online, like I said, 90 seconds. Living donation starts the minute you see a story, pick up the phone, hear from a donor champion, or have a loved one who needs a liver or a kidney transplant, and then they get you in touch ultimately with that transplant center. I'm really proud of the state of Texas. We're the only state in the country right now that when you register your wishes on an iPhone, and 5,000 Americans do that every day, if your zip code pops up as Texas, after you register your wishes to be an organ, eye, and tissue donor, the next message is there are over 100,000 people on the wait for a kidney transplant. Do you want to learn more about living kidney donation? So proud to say Texas is leading the country that way, to see if maybe that altruistic giving, when people are motivated to register to be an organ, eye, and tissue donor, maybe they actually would like to help now and help a little sooner.
So one thing I want to emphasize is you said giving, and like a couple of people mentioned earlier, it's you don't pay to get an organ or anything like that.
No.
Someone's giving you a gift.
That's right.
Of course, and I know it isn't regarding living donation, but for deceased donation, I always tell our recipients who receive a deceased donor transplant, you can imagine, as you even mentioned, they're celebrating their new life, but they're really grieving and they're feeling this guilt. And there's this sense, sometimes recipients will say, I hate that someone had to pass for me to live. But when I speak to recipients, what I say is people are passing. People are dying every day, ERs, pediatric hospitals, adult hospitals, nursing homes. You're not changing that. You happen to be on a waiting list. And just a handful of those people that die every day in America are eligible to medically donate organ, eyes, or tissues. How lucky is that donor family that there was nothing that was going to change the fact their loved one died, but they have the silver lining of all of these futures and legacies and the gift of life they passed on. As Kimberly has said earlier, no strings attached. You don't even know who you're helping. And I think, and I'm a donor family myself, and I know what peace it brings to you and comfort. And I always like to tell our patients that because I think they then realize they were a gift to the donor family, just as that organ saved their lives.
Absolutely.
Thank you so much, Jennifer. Thank you, Dr. Thomas.
Thank you.
Well, like we talked about, talking to people about how organ donation changes so many lives has become one woman's passion. We're going to introduce you to her. She knows that firsthand that registering to become an organ tissue and eye donor is an important first step, and she hopes by sharing her daughter's story that it will encourage more people to become organ donors and share that gracious gift.
Lolly Gomez has been advocating as a TOSA volunteer for the past 20 years. Talking to people about how becoming an organ donor can change lives is her passion.
There's a lot of myths, there's a lot of misconceptions about becoming an organ donor. Yeah. And some, we try to get those answered for the potential donor registered. And after hearing the answer, then it gives them peace of mind to sign to become a registered donor.
Her support for organ, tissue, and eye donation started on June 28, 2003, when she was approached by members from the Texas Organ Sharing Alliance, or TOSA, to see if she would consider donating her daughter's organs.
My daughter was 20 years old. She loved life and lived life to the fullest. At that age, they want to just do what they want to do. And because of that, I respected her wishes.
Yvette was preparing for a weekend volleyball tournament. And the Wednesday before the game, Lolly talked with Yvette about how she planned to get there. She said she arranged for a friend to pick her up, but something about that moment didn't feel right with Lolly.
She wanted to eat enchiladas before she went to play her tournament. So we were in the kitchen cooking, and something in me just told me to say these words. And I'm a big believer of signs. Not knowing that that was going to be my sign to her from God, I asked her that I did not want her to go on the motorcycle to the volleyball tournament or come back with her friend on the motorcycle, because I was afraid to get that call that no mom would want to ever get.
There was a family softball game on the Friday before Yvette's volleyball tournament. Lolly remembers the fun and excitement everyone was having, but she also remembers the small spat before Yvette left with her friend to the tournament.
Friday night we played softball, and she went about her merry way. She did leave a little angry, although because she wanted to play catcher. I was playing the role as a catcher on the softball team, so we placed her to play outfield. So she was still a little upset at me at the end of the game, but nevertheless we hugged and said goodbye, be careful. Little did I know that that was the last time I was going to see her alive.
During the early morning of June 28, 2003, Lolly received the phone call she dreaded. On the other line was Yvette's best friend trying to explain what happened.
At 2:30 in the morning, and that's the exact time that I had that talk with her on that Wednesday, is I didn't want to get that phone call at 2 or 2:30 in the morning. And I did. I received that call about 2:30 in the morning on Saturday morning after our softball game on Friday night. And it was her best friend, crying, telling me that she had been injured, and for me to rush to BAMC Hospital. Upon arriving, the doctors did gather the family and give us the news that she was brain dead.
Becoming an organ donor wasn't something Yvette had always thought about or even discussed with her family.
She had not made that to be her wish, to be a donor. So we talked to, I'll never forget his name was Mike, and he explained to us what TOSA did and what the statistics were about organ and tissue and eye donation. It was immediately a yes for our family. And that is how I became involved. My daughter saved 5 lives.
Lolly's beautiful, free-spirited daughter, Yvette, who lived the life to the fullest, changed the lives of 5 other people. Through the gift of organ donation, Yvette became a heart, lung, kidney, and pancreas donor. Lolly says she still keeps in touch with the people who received her daughter's heart and lungs. The recipients are like extended family members to Lolly and her family, and she's comforted to know that her daughter's donations has given each recipient a second chance at life, allowing them to reach milestones in their lives.
It's a blessing. It's a blessing that we were able to provide a second chance of life to those that have received her organs.
Yvette continues to touch the lives of people who know her story. Lolly personally acknowledges the importance of becoming an organ donor. She's registered now, but says it wasn't until after her daughter's accident.
I am a registered donor, and I became a registered donor after my daughter's accident. It changed the perspective for the entire family and friends, co-workers, strangers, you know, so it did change us. It did see us. We did learn a lot, and we're still learning, you know, because every day is a learning day.
Yvette is Lolly's only daughter. She admits sharing her story is painful, but it gives her and the family joy to know Yvette's life still lives on in others. For Lolly, reaching just one person and changing their mind about becoming a registered organ and tissue donor brings her the greatest satisfaction.
I would like to encourage the public to please sign up to become a registered donor. It has meant the world of difference to our family. It allows us to heal at the same time, and you just never know whose life you will change.
Director of Donate Life Texas, and of course Lolly. First of all, thank you so much for being here, both of you. I wanted to, you know, this is incredibly emotional. I know you were wiping away tears when that package was running, but you know, it might be tough for people to comprehend. You know, I lost my loved one, and I made the decision to give the gift of life to someone else by donating their organs. And you know, some people might shut that away and just move on, but you've made this part of your story.
Yes, ma'am. It's been 20 years, almost 21 years that I've been sharing my story about my daughter to bring awareness to many, not only family members, but also to strangers.
I guess, how does that make you feel knowing that you're making a difference like this?
I call it a blessing for others. It's a blessing because through me saying yes, we'll donate my daughter's organs, it's allowed others to live on. So we gave a gift of life.
Thank you so much. And we'll get back to you in a second, but Jennifer, I want to come to you because I mean, that's a difficult decision that a family member has to make to decide whether or not they want to donate their loved one's organs. So let's just go back to the beginnings. Would you mind explaining the clinical definition of brain death?
Sure. So there are 2 types of deceased organ donors that are allowed to do organ donation, and that's brain dead and deceased circulatory donation. So in a brain dead donor, which is right now the most common type of organ donor in the US, even more common than living donation or DCD donation we call it, the legal definition of brain death is irreversible cessation of the respiratory and circulatory system. So that means that after someone's passed, they cannot spontaneously restart their heart or their breathing. So I often tell people that in the attempt to, when there's been a head injury, there's swelling of the brain, and the hospital teams are doing everything they can to decrease that swelling and stop that head injury from progressing, but they can't. When I used to work with donor families like yours, we used to show them a flower in a vase of water and a picture of that and say, is that flower still alive? And after they thought about it a little bit, they would say, well, it's not, because the roots aren't there. We'd say, yes, but the cells of that flower can be maintained for a short period of time and the flower is vibrant. So in brain death, the brain has died. There is no blood flow to the brain. Because of the advances in medical technology, we have placed machines and medications to control heart rate and warming and temperature, and that brain dead individual, like that flower, has a short window of time where those cells are still vibrant and they're able to still share life. So that's a brain dead donor. And it's hard for a family, because often if you think about in your own growing up, your own experiences, what death looks like or means to you personally, and you walk into a critical care ICU room of someone who has experienced brain death, they don't match up because their chest is rising, a monitor shows a heartbeat, they often look warm and feel warm to the touch. So those teams really do an amazing job at explaining what brain death is and sharing how there is the definition of death. This is irreversible, and that only the machines are keeping the cells of the body alive at this point.
You know, some people might, see what you saw, you described, that person's loved one is breathing or appears that they're breathing and they're warm. And some people might think, well, maybe my loved one's in a coma. What's the difference between brain death and a coma?
So in a coma, parts of the brain are still functioning. In brain death, and there's a test that can be done, and it helps illustrate this, a cerebral blood flow, and they'll put dye and they'll do an image of the brain, like an x-ray. And anywhere that dye is circulating normally looks like little mirrors flashing, but there's no blood flow to the entirety of the brain. So the brain stem has no function. All of the lobes of the brain have no function. In a coma or a persistent vegetative state, there are still parts of the brain that are getting blood to it and are working. But in brain death, and brain death, although tragic, one thing that we'll tell the families is you're not making the decision to remove life support. Even though the machines are still on, there actually is already a pronouncement in a time of death. And again, you're thinking about that flower, and you've got that short window of time where you're still able to surgically recover organs and share that gift of life.
Molly, I want to go back to you really quick because you're an aftercare volunteer, right?
Yes, ma'am.
What has been your experience working with aftercare volunteers?
It's been a great experience. I love the staff. And this is one way that I can give back to the community also, is by sharing my story, not only of my mother, but also, not only of my daughter, but also of my mother. My daughter did save 5 lives, so I want to share that with others that have a misconception about getting on the registering as an organ donor. And then I come and let them know also about the story about my mother. My mother was a cornea and tissue donor as well. So I've got 2 stories to tell, and a lot of folks are on the fence about becoming registered donors. And when I tell them my story, majority of the time they will sign up to become registered donors.
I'm just curious, was your mother inspired by your daughter's donation?
Well, my mother's death happened suddenly, so she was not able to become an organ donor because she died on impact. So we were able to sign. Well, I didn't know until my dad presented me with her medallion that he received from the eye bank, and because he was an next of kin, he made the decision for Mama to be a tissue and eye donor.
Thank you for sharing that.
Welcome. Thank you.
And so, Chad, I want to move on to you because very recently Governor Abbott signed the Living Organ Donor Education Program into law. Became effective last September. What does this mean for donors and recipients?
Yeah, it's going to mean more lives saved ultimately. I think at some point we realized if we only relied on deceased donors, we're really not going to whittle away at that wait list of 10,000 Texans awaiting a life-saving transplant. We have to get better at leveraging living donation opportunities. So Senator Kelly Hancock was one of the gentlemen who was key in drafting that legislation, Senate Bill 1249. He is a kidney recipient from his son-in-law. And so we helped draft that legislation, testified in Austin there at the Capitol on behalf of that bill in the House and the Senate. And really what it means is Donate Life Texas and all the partners, a lot of partners that you've seen here today on the panel, will be working with the state's Department of State Health and Services to educate folks on living donation opportunities, whether it be starting a kidney chain with the National Kidney Registry, whether it be registering with the National Living Donor Registry through Donate Life America. But we have done already a lot of groundwork on that program, updating our materials, talking about it in forums like this. If you want to go to donatelifetexas.org, right up top, there's a tab about living donation that lays out opportunities. So if we're serious about getting after the waiting list here in Texas and the 10,000 Texans awaiting a life-saving transplant, we're looking to educate and inform folks on living donor opportunities.
Why is that so important to you?
Yeah, it is crucially important. I tell you, you don't have to spend much time. I've been in this world for not quite as many years as some of the panelists, but seeing the stories, hearing folks like Lolly talk about, I think a lot of us walk through life and we don't really think about it until we're individually impacted. Growing up, I did not know folks in my immediate family impacted by donation, but I've seen so many now, and it's hitting closer to home on the importance of it. So literally, most people can't go through their life and think they can do something to save somebody's life. But registering as a donor or being a living donor, you can literally save someone's life. And what that does for not just the folks receiving the transplant and their families, but the people that donate as well and their families. It's very, very powerful.
And I want to give you guys the chance to give any lasting thoughts for people who, might be on the fence about whether or not they want to become an organ donor. Chad, I'll start with you. I mean, what would you tell someone who just isn't sure?
Yeah, I would say get the facts. I mean, Texas is what we call a first-person authorization state, which means you have the ability to decide for yourself your desires for donation. At donatelifetexas.org, if you want to register, you can specify the type of donation or certain parts or certain organs or certain tissues that you want to donate. You can donate just for transplantation and not for research. So we've made it to where Texans can register their decisions consistent with exactly what they want to do. And the second part I would stress to folks is to have that discussion with their families. We had a cute little message, the Texas two-step. Step one being to register. Step two, to have the talk with your families. Because as some of the panelists had mentioned earlier today, don't burden your family with that decision. They're going to be making a lot of decisions likely. If the conditions exist for you to be a donor, take that decision away, that burden away from them, and let them know what you want to do.
And Jennifer, I want to jump to you. What would you tell someone?
Well, I would say I just come back to most people say yes. They just don't have an opportunity to register their wishes. And it never occurs to them to have a conversation about end of life with their family. So for me, I would tell people to register their wishes now. I love the two-step concept. What a great fit in Texas. You can give that information, encourage your family to donate, but that's what I would really tell you. Find an opportunity and find a way. And we have at University Health Transplant Institute a waiting list of babies waiting for livers, young kids who've been on dialysis for years waiting for a kidney on the waiting list, adults and waiting for liver, kidneys, and lungs. We see every day these patients we fall in love with and fight and love their families dying because they never got the call that they got a chance. So I thank Texans, I thank Donate Life Texas for amazing work as a nonprofit just trying to help us deliver that care to a patient. So I think Texans do the right thing. We have to find opportunities for Texans naturally to find ways to register.
Yes, definitely.
Lolly, unfortunately, someone's going to have to end up in the same position that you ended up, and they're going to be grappling with that decision. As someone who's gone through it, what would you tell someone who has to make that choice?
I would say to them, please take the opportunity to register. It has been a world of difference for my daughter's recipients. Just Saturday, I was able to witness my daughter's heart recipient's son get married. So there were small children when Chuck received my daughter's heart, and I've seen them grow and, you know, graduate from high school, from college, and now on to one of them being married. And it is a very, very comforting to me as a donor mom to see that because of making the choice for Chuck to receive my daughter's heart, he's gone on in life to enjoy his family that much longer.
It's incredible. I'm almost crying. Like, I can't believe that. Well, thank you all so much for joining us and for sharing your story with us. Now, for our viewers at home, we want to remind you April is National Donate Life Month. It's time to celebrate donors and to bring awareness to the cause of organ, tissue, and eye donation. Tune in to GMSA tomorrow morning for our tomorrow morning. We're going to have two, not tomorrow, April 3rd, from 5 a.m. to 10 a.m. for our KSAT Community Phone Bank. All right, thank you for watching.